Imagine this: you're in the operating room, managing a complex spine surgery in the prone position. Neuromonitoring is active, ensuring the patient's neural pathways stay intact. But afterwards, the patient complains of severe jaw pain and swelling. What happened? Let's dive into the fascinating and critical topic of masseter muscle necrosis during anesthesia in this episode of Optimal Anesthesia. Picture this: an intricate spinal surgery is underway. The surgeon is navigating structures millimeters away from vital neural pathways. How can we ensure the spinal cord and motor nerves remain unharmed during these high-stakes maneuvers? That's where motor-evoked potentials come in. So, what exactly are MEPs? MEPs are generated by electrically stimulating motor pathways, causing muscles to contract. These responses allow real-time monitoring of motor nerve integrity during surgery. In essence, they act like a warning system, alerting the surgical team to potential neural compromise caused by manipulation, ischemia, or trauma. So, what leads to masseter muscle necrosis during MEP monitoring? It's a combination of prolonged stimulation and ischemic injury. Here are the key players. First, ischemia. When the masseter muscle contracts for too long, it compresses its blood vessels. This limits oxygen delivery, and studies show that if ischemia lasts over 6 hours, irreversible muscle damage can occur. Next, reperfusion injury. Once the blood flow returns after ischemia, oxidative damage can occur. This is due to the release of reactive oxygen species and the activation of inflammatory pathways. Third, energy depletion. Repeated contractions burn through the muscle's ATP supply, its energy currency. Without ATP, essential cellular processes fail, triggering necrosis. Lastly, the inflammatory cascade. Muscle damage activates an immune response, increasing vascular permeability and causing edema. Over time, this inflammation exacerbates the injury. If undiagnosed, the consequences can be severe. Let's start with the most obvious one: pain. If masseter muscle necrosis goes unnoticed, the pain doesn't just stay in one spot. Over time, it can lead to something called myofascial pain syndrome. That's a fancy way of saying your jaw pain could spread to other areas, making everyday activities like eating or talking unbearable. Now imagine this: you go to take a bite of your favorite food, but your jaw just doesn't cooperate. Necrosis can cause significant functional limitations, making chewing, speaking, and even opening your mouth a struggle. This can even lead to nutritional deficiencies if you're not able to eat properly over time. Here's a less obvious consequence: facial asymmetry. When the masseter muscle becomes damaged or atrophied, it can change the shape of your face. Swelling or muscle loss may lead to visible deformities, which, let's be honest, can take a toll on your confidence. Your jaw doesn't just help you chew, it keeps your teeth aligned too. When necrosis alters your jaw mechanics, you might develop something called malocclusion, or misaligned teeth. This can lead to an increased risk of cavities, gum disease, and other dental complications. And let's not forget the biggest danger: infection. Necrotic tissue is like a playground for bacteria. Once an infection sets in, it can spread quickly, leading to even more complications and requiring aggressive medical treatment. So, there you have it: 5 serious consequences of undiagnosed masseter muscle necrosis: chronic pain, functional limitations, facial asymmetry, dental issues, and infection risk. Early diagnosis is key. Let's break it down into simple, actionable strategies that can make all the difference. First up, let's talk about neuromuscular blockade. During parts of the surgery where MEP monitoring isn't needed, use short-acting neuromuscular blockers. These agents help reduce muscle contractions without interfering with the critical monitoring phases. Next, Team up with the neurophysiology crew to fine-tune the stimulation parameters. Lowering the intensity and frequency can be just as effective while also protecting the masseter muscle from overuse. Periodic muscle relaxation is essential. Advocate for breaks in stimulation to give the muscle time to recover, restore blood flow, and prevent ischemic damage. Proper positioning is often overlooked, but it's vital. Use padding to prevent additional compression on the masseter and ensure the patient's head and neck are in optimal alignment. Stay alert for signs of muscle swelling or dysfunction post-op. If you suspect necrosis, initiate imaging right away. Early detection can significantly improve outcomes. And finally, document everything. Detailed records of MEP parameters and intraoperative events not only help with postoperative care but also ensure smooth communication across the team. So, there you have it, 6 strategies to protect your patient from masseter muscle necrosis during MEP monitoring. Remember, as anesthesiologists, we're a crucial part of the team. By following these steps, you can help ensure patient safety and optimal outcomes. Thanks for watching. Don't forget to like, share, and subscribe for more insights into anesthesia care. This episode doesn't end here. Stay tuned, because in our next video, we'll dive deeper into masseter muscle necrosis. See you soon!